Right now, there are 85 prescription medications sitting on the FDA's official warning list for grapefruit interactions. 3 of those are among the most frequently prescribed drugs for adults over 60. When you put them together, they are taken by nearly half of all seniors in this country. The interaction we are talking about is not subtle. If you combine the right medication with just a single glass of grapefruit juice, the blood levels of that drug can spike to 2, 3, or even 5 times the intended dose. Your body essentially goes through a massive overdose, even though you took the exact amount your doctor prescribed. This effect lingers for 24 to 72 hours after just one exposure. Yet, almost no patient gets warned about this at the pharmacy counter. I'm Dr. Goodman, and on this channel, we look closely at the published research behind the medical decisions that matter the most after age 65. Today, we are going to talk about what grapefruit actually does inside your digestive system, the 3 categories of medication that become dangerous when mixed with it, the specific drug that is the riskiest and least talked about, and 4 simple rules to keep yourself safe. Throughout this talk, I will mention patient cases, but the names and details are illustrative composites based on common clinical scenarios. The history of how we even found out about this grapefruit drug interaction is fascinating on its own. Back in 1989, a Canadian researcher named David Bailey was running a clinical trial on a blood pressure drug called felodipine. He needed a way to hide the drug's bitter taste, so he picked grapefruit juice, assuming it was just a harmless mixer. But the drug levels in his trial subjects came back 2 to 3 times higher than anyone anticipated. His team published these findings in the Lancet in 1991. It was the first time anyone documented a food directly and dangerously interfering with how a drug is metabolized. And it was discovered completely by accident. Since that time, science has figured out the exact mechanism. Grapefruits contain specific compounds called furanocoumarins. These compounds block an enzyme in your small intestine known as CYP3A4. That enzyme is responsible for breaking down a lot of medications before they can enter your bloodstream. Under normal circumstances, when you swallow a pill, your intestine destroys a fraction of it during absorption. Drug manufacturers know this, so they calibrate the prescribed dose based on your normal CYP3A4 activity. But when grapefruit blocks that enzyme, the medication slides through your intestine completely intact. Much more of the drug hits your bloodstream than the dose was designed for. Your blood levels shoot up. Side effects that would normally be rare become highly probable, and side effects that are serious can become life-threatening. And this isn't a fleeting effect. Grapefruit doesn't just temporarily pause the enzyme, it actually destroys the CYP3A4 protein molecules entirely. Your body has to build brand new ones, which takes anywhere from 24 to 72 hours. That means a single glass of juice at breakfast can alter how your body processes medication for the next 2 to 3 days. Let me tell you about a patient we will call Walter. He was a 68-year-old retired contractor who had been taking 40 milligrams of simvastatin every night for 8 years to manage his cholesterol. His lab numbers looked great, and he felt perfectly fine. One winter, his daughter sent him a beautiful box of fresh Florida grapefruits for the holidays. He wasn't usually a grapefruit eater, but he appreciated the gift and started eating half a grapefruit with breakfast every day. About 10 days into this routine, his calf muscles started to ache. He figured he had just pushed himself too hard on a walk. But 2 days later, he could barely walk at all, and his urine had turned the color of dark tea. Walter ended up in the emergency room. His creatine kinase, which is a marker for muscle damage, was over 50 times the normal upper limit. He was in the early stages of rhabdomyolysis, a severe condition that can lead to kidney failure. He spent 4 days in the hospital, receiving intravenous fluids to flush out his kidneys. The culprit was the combination of his simvastatin and the grapefruit. The drug levels in his blood, from the exact same dose he had safely taken for nearly a decade, had spiked high enough to literally start breaking down his muscle tissue. Nobody had ever warned him, not his pharmacist and not his cardiologist. The interaction was clearly listed on the FDA's warning list, but it just never came up in standard conversation. Thankfully, Walter made a full recovery. He takes a different statin now, one that doesn't react with grapefruit. He still gets that holiday delivery from his daughter, but now he hands the fruit straight to his neighbor. Before we jump into the 3 medication categories, there is a quick caveat. This interaction applies to a few other fruits that people don't always link to grapefruit. Pomelos, which are larger, sweeter Asian relatives of the grapefruit, do the exact same thing. Seville oranges, typically used in marmalades, also cause this interaction. Tangelos, a pomelo hybrid, carry a partial risk. However, regular sweet oranges, mandarins, lemons, and limes are perfectly safe to consume with these drugs. This distinction is vital because people sometimes switch from eating a grapefruit to spreading marmalade on their toast, thinking they have solved the problem when they actually haven't. If you have ever had weird side effects after eating grapefruit while on a prescription, please leave a comment telling me what happened. Real experiences from patients help shape all the videos I make. The first category to watch out for is statins. This is by far the most common interaction, simply because statins are the most frequently prescribed drugs for older adults. The statins that interact dangerously with grapefruit are simvastatin, sold as Zocor, lovastatin, sold as Mevacor, and to a slightly lesser degree, atorvastatin, or Lipitor. Simvastatin and lovastatin are affected the most. Blood levels can jump 3 to 5 times higher than normal if you regularly consume grapefruit. Atorvastatin usually sees about a 50% increase. The primary risk here is muscle damage, ranging from simple aches to the severe rhabdomyolysis that Walter dealt with. However, statins like pravastatin, rosuvastatin, and fluvastatin do not have a significant interaction with grapefruit because they are processed by entirely different enzymes. So, if you want to keep eating grapefruit, ask your doctor about switching to one of those safe alternatives. It just takes one new prescription to eliminate the risk. The second category involves certain calcium channel blockers, specifically felodipine, nifedipine, and to some extent amlodipine. These are widely used blood pressure medications. Mixing them with grapefruit can cause a sudden and severe drop in blood pressure, which is especially dangerous for seniors. Symptoms include dizziness, feeling lightheaded when you stand up, fainting, and potentially serious falls. Felodipine is the most reactive, with blood levels sometimes tripling. Nifedipine is also heavily affected. Amlodipine, which is the most commonly prescribed of the group, has a milder reaction, but it's still significant enough that you should limit grapefruit to occasional use, rather than making it a daily habit. If you take one of these, ask your doctor if your specific drug has a known grapefruit interaction. If it does, you need to either avoid the fruit or discuss moving to a different class of medication, like an ACE inhibitor or an ARB, which do not have this issue. The third category is amiodarone. This is the medication that almost no one gets warned about, yet the published literature suggests it is the most dangerous of the 3. Amiodarone is prescribed to manage heart rhythms like atrial fibrillation. It already carries a very complex side effect profile and can impact the thyroid, lungs, and liver even at normal doses. If you add grapefruit to the mix, blood levels can rise significantly, heightening the risk of dangerous heart rhythm shifts, severe heart slowing, and multi-organ toxicity. Furthermore, amiodarone has an incredibly long half-life of 50 days or more, meaning the drug slowly builds up in your tissues over months. Stacking grapefruit on top of a drug that clears the body that slowly creates highly unpredictable risks. If you are on amiodarone, you should completely avoid grapefruit, pomelos, and Seville oranges. The safety margin is just too narrow for even occasional exposure. To protect yourself, regardless of what medication you take, there are 4 simple rules. Rule 1 is to read the medication insert. Those folded papers have all the interaction warnings listed. If grapefruit is mentioned anywhere on that document, take it very seriously. Rule 2 is to ask your pharmacist directly. Every time you pick up a new prescription, ask them point blank if the medication interacts with grapefruit. Pharmacists check databases that are often more comprehensive than what gets discussed in the exam room. And it only takes 30 seconds. Rule 3 is to treat pomelos and Seville oranges exactly like grapefruit, as they share the same problematic compounds. Don't let a fruit salad or breakfast marmalade catch you off guard. Rule 4 is the 24 to 72 hour rule. Since a single glass of juice disrupts your enzymes for up to 3 days, you cannot safely space out your medication. Taking your pill 12 hours after eating a grapefruit does absolutely nothing to prevent the interaction. Total avoidance is the only safe strategy for drugs on the warning list. Walter sent me a picture just last month. He was standing in his daughter's kitchen, holding up his annual holiday box of grapefruits with a little smile. Right next to him, he had slapped a sticky note on the box that read, "For the neighbor, not for me." His doctor switched him to simvastatin. His muscles have entirely healed, and his cholesterol is perfectly on target. He told me later that the part that frustrated him the most wasn't getting sick. It was the fact that this warning had been documented by the FDA for years. A simple phone call to his cardiologist fixed it, but the conversation that could have spared him a 4-day hospital stay never happened during his dozens of routine checkups while he was on simvastatin. If you are taking a statin, a calcium channel blocker, or amiodarone, please pause this video. Go grab your pill bottle and check the insert to see if grapefruit is listed as a warning. If it is, and you have been eating it, call your pharmacist this week. Don't wait until next month. It takes 3 minutes and removes a very real danger from your life. Drop a comment and let me know if a doctor or pharmacist has ever specifically warned you about eating grapefruit with your meds. I am guessing most of you will say no, and the trends I see in those comments help me decide what to film next. For the next step in this conversation, we will be looking at 4 medications that silently destroy your body's ability to absorb vitamin B12, and the specific test most doctors forget to run to catch the nerve damage it causes. That video is up next, and the link is right on your screen. I'm Dr. Goodman. Take care of each other.